It's time for DocTalk Radio, brought to you by Gilbert Hospital and Florence and Anthem Hospitals. I'm Dr. Ann Borik, board certified in internal medicine, and I'm here to keep you up to date on the latest information pertaining to your health and well-being. Welcome to DocTalk Radio, sponsored by Gilbert Hospital and Florence Hospital at Anthem. Joe, how are you doing today?
I'm doing great. How are you, Dr. Borik?
Good, good. We have a great show in store today. We're going to be talking about nursing. And we have Janet Bobett in the studio here, who's an RN. She's the nurse manager of the Gilbert ER Hospital and Florence Hospital at Anthem. And we're going to be talking about things like how the economy is impacting nursing and you know, what the hospital offers from a nursing perspective, some of the challenges of working as a nurse, some of the myths about, you know, our hospital. And so, Janet, thank you so much for being here.
Thank you for having me. I'm honored to speak on behalf of the nurses at Gilbert and Florence hospitals.
That's awesome. You know, tell us a little bit about your responsibility at the hospital.
My responsibility as the nurse manager for Gilbert Hospital and Florence Hospital at Anthem is to assure that the nursing staff is competent, mentoring, hiring, doing the scheduling, and leading this multi-skilled task of nursing.
Well, you know, I'm sure that your background is, I'd love to hear a little bit about your background as a nurse, because I'm sure that when you went to school, you know, you weren't really taught how to do scheduling and, you know, and all of that, and it's kind of morphed, I would assume. Is that right?
Oh, absolutely. I've been in nursing over 20 years. I began my career as a CNA. I've spent many years in the military as a nurse, as
really?
an LPN.
Wow.
Yes, and in the military you get a wide variety of experience from running sick call with the troops all the way up to working in the intensive care unit. A lot of my leadership skills I can attribute back to being in the military. In the civilian world, I've worked the majority of my career either in the emergency department or on the telemetry floors. I've also worked a little in the skilled nursing facilities and in physician's office, so I have a wide, varied background.
Yeah,
nursing.
you know, and I guess it would be really important, you know, from an ER perspective, knowing where that patient's going to go after they're discharged.
Oh, absolutely.
So having been working in the skilled nursing facility and on the outside, that kind of gives you a little head start, I guess, you know, in helping to predict and pave that path for discharge planning.
Yes, absolutely. A lot of nurses that we have working in our departments have a varied background, which gives us all a little bit of experience to pull from each other. We may not know everything, but we know who our resources are and where to get that information for our patients.
That's great. You know, Gilbert Hospital and Florence Hospital at Anthem is unique. And I want you to kind of give us a little information about the uniqueness of the hospital from a nursing perspective.
From a nursing perspective, I think the uniqueness goes back to the size of the facilities. We know pretty much everyone within the facility by name, and that starts from the registration staff all the way up to the physicians. That's something you don't see in a larger hospital.
Right.
It gives us a lot of you know, that hometown feel within the facility here in this large valley. I've worked in many facilities where I didn't even know the nurses that I was giving report to.
Isn't that interesting? And it's so different in Gilbert and Florence hospitals.
It is. The speed in which we deliver our good nursing care is also different. Our patients are greeted right there in the lobby, most often by a nursing staff. A lot of times we actually have 2 or 3 people greeting the patients, taking them into the emergency department rooms and initiating their care. The physician is usually straight on our heels. Sometimes the physician beats us into the rooms. It's very different than other facilities. There's none of that waiting process, and I think that is carried through all the way from going into the emergency department all the way through discharging home, or if they're admitted into the inpatient department. Our nursing staff feels very proud to take that stance in nursing care that our patients shouldn't wait.
Right. You know, you actually have been with Gilbert Hospital from the very beginning. What, just a couple weeks after they started?
Yes, I went in, I worked with a registry nurse at the other facility, and she said, "Janet, you've got to come see this facility. They are so much like you." And I'm very loyal to where I work. I was very hesitant to even go over there, so I told her I'll take a tour, and I've never left.
Really?
It's an amazing. From the moment I walked in the door, I thought, this is where I need to be.
Isn't that neat? Now, I work there, and obviously, everything that you're saying, I can, back up 100%. With the nurses that are there are very happy, and I hear that from my patients. And do you get that, or what? Tell me about that.
When I work on the floor, I think at least once a day I'll have a patient or a patient family member ask me, "Why are you guys so happy?"
Really?
And, how do you do that? How do you just hire happy people? And, well, we're happy in our job. We like what we do. And that you can't teach. You can't, that's something that just comes from being in that environment.
You know what, Dr. Borik?
Yes.
I have to say, I run into people all the time that work at the hospital.
Right.
Now that we do the show, every single person that I've run into, and I ask them, they love it at the hospitals. At both hospitals, they absolutely love to work there.
It really makes a difference, and I think that's really translated into really good patient care.
Absolutely.
Ultimately, that's the goal.
If you enjoy your job, you do a better job at it.
Is it true, and this is a question that I've heard, and I want to really ask you, that there's a low turnover of nurses? Because I don't see new nurses coming and going. Tell me about that whole process of nurses trying to come in to work at our hospitals.
I'm very privileged to take part in the hiring process within the emergency department. And more often than not, when I interview somebody for a new position at the hospital, they tell me, "Oh, I'm so grateful to have this interview. I've turned in my application 3 or 4 times. I've been waiting for years sometimes."
Really?
Months or years. And they're very excited to take part of that. Nursing is a very small community. I know it seems very large across the valley, but our word is out that our nurses are happy. That I work with some of the same nurses that I was working with 6 years ago when we opened the door, and that's unheard of.
Wow, that's amazing. We are open for call-in, so anybody out there listening, feel free to call in. You can ask questions, about nursing, about our hospital, whatever the topic that you want to talk about. 480-745-1033. Before we were talking a little bit about generations, and it was amazing. You told me that there were 4 generations of nurses that work side by side, or
Yeah, in our emergency department, well, I've learned that because of the economy, we have nurses that are staying in the field much longer than they had anticipated. So they're staying on the floor. They're active. They're working. It's not uncommon to have an 18-year-old tech that's brand new into the field working side by side with a 60-plus nurse. And the two generations actually speak a different language, and we do it very, very symbiotically. All of our nurses at Gilbert Hospital want our techs, we want our medics, we want the younger generation of nursing to succeed. And part of that is we have to kind of put aside those generational differences that we have and work side by side and learn how to make it work, and we do it very well every day.
Right. Wow. Gilbert, the slogan is door to doc in 31 minutes. And, you were there from the get-go, and I think we have maintained that for 6 years.
Yes.
In fact, I think we've beat the 31-minute. Walk us through, if somebody out there, we're getting into the busy season now, people coming into the ER. And I remember as a hospitalist working in the Valley, I'd have patients waiting 12, 14, sometimes 24 hours in the ER.
It's absurd.
It is. I actually had to transfer a patient out of state just because there were no beds available. And this was years ago. But, since I've been at Gilbert Hospital, I don't even see anybody waiting in the waiting room.
Yeah, we kind of laugh that's a waste of space within our hospital.
It really is. But can you walk us through, if somebody comes into the ER, what happens? How do we pull that off? How does that happen?
Initially at that registration point, it's a rapid reg. They're just getting a little information like your name, maybe even your phone number. And you're taken right back to the emergency department by a nursing staff. At that time, you're triaged right there in the room. Usually within minutes, that physician is coming in the room. I kind of chuckle a little when I hear the door to doc in 31 minutes, because to me, if that clock's ticking near 31, I'm getting anxiety. So we don't see that 31. That's normally a long time not to see the physician. That doc's in with the speed of our electronic medical record. They are putting orders into the computer. The nursing staff is getting their treatment initiated. A lot of times that x-ray staff or the CT staff, whatever it may be, is coming at the door as we're leaving the room, taking them down to get their images done. We've already got the lab drawn. This is all happening within that very short time when they come in the emergency department. more often than not, we have our patients treated, feeling better, diagnosed, discharged, while in another bigger facility, they're still sitting in the lobby.
Right. I know for those patients that are being admitted, a lot of times, I'll just kind of walk over to the ER to see the patient while they're still in the ER, and a lot of times they're already off getting a test, or it's pretty amazing actually. They don't waste too much time.
No.
Now another question that I have, when, for example, we're an acute care community hospital.
Yes.
So first of all, define that for me. We're not. What are some of the myths about the hospital that I think we want to set the record straight, right?
Yeah, some of the myths that I've come across in the years that I've been working at Gilbert Hospital is we're not an urgent care.
Right.
I think just because of the size of the facility, people drive by and look at it and assume that we're an urgent care, because how could you possibly be a full-service hospital in that small hospital? We are much bigger than we look. Mm-hmm. We're not a veterinary clinic unless... Right. Nowadays, we're using helicopters to transport the animals in their veterinary emergencies.
Right.
Some of the other myths with this small facility is that we don't admit. Absolutely, we admit. Mm-hmm. We have a surgical suite that's busy, sometimes 24 hours a day, doing a very wide variety of surgical procedures. We have a full-service med-surg, telemetry observation unit. We have intensive care unit. We have the capabilities to care for the critical patients.
Right, and I could attest to that because that's what I do. I mean, that's my part of the hospital to manage. So I think it's important, even for some of our colleagues out there, to understand that we are an acute care facility. We don't have a cath lab. And so I want to talk a little bit about that because, my understanding and if somebody comes into our ER with an acute myocardial infarction, I've seen numbers, and I want to kind of confer with you, where a patient who comes into our hospital, at Gilbert ER Hospital, needs to go to the cath lab, literally is transported from our door to the cath lab in less time than if they went into the ER of the hospital that had a cath lab.
Yes, that's true. We are a certified chest pain receiving center, which is a very big honor for us because we do not have a cath lab.
Right.
National standards are from the moment a patient enters into the lobby of a hospital to register to the time they get to the cath lab and actually have those arteries opened so that we can save cardiac tissue, that standard's 90 minutes.
Right.
And for us not even to have that cath lab, we're behind the ball curve already. So we very well have it down to a fine science of how to care for those patients. They enter into the department, you have a whole slew of staff that is in there taking care of them, starting IV lines, giving the medications, for example, aspirin. X-ray will be right outside the door to perform a portable chest X-ray. The physician is right there. We have the helicopter on the roof, so with a simple phone call, that staff is down there actively participating in that transfer of care. Our standard for an acute MI or a sudden heart attack is to have them in the door and onto the helicopter on their way to the cath lab within 30 minutes.
Wow.
When we call to get a spot in that cath lab, they know on the other end of that phone that we do not have a cath lab, and they're very quick to accommodate us. We don't have trouble getting our patients to a cath lab.
Right. And that makes a huge difference. I think part of that is because the hospital is really run by physicians. It's a physician-run mentality.
Absolutely. And the physicians respect the nursing staff very highly at Gilbert Hospital. Those nurses that are at the bedside, they take their opinion, they listen to their professional assessments. It's very, very much a team effort from that nursing and physician staff at both facilities.
Right. You said something that really rang true when you said that you know the name of all of the nurses that work in the hospital.
Yes.
And it's true, I do. I mean, it's amazing to really have a physician or a nurse that knows the name of all of the nursing staff and all of the staff in the hospital. That's what's unique about, I think, Gilbert Hospital.
Yes, I've worked at other much larger facilities where frequently I'm called nurse, which is fine. I am a nurse, and I'm proud of that.
Right.
But it's really, really nice for a doc to come in and say, "Hey, Janet," it kind of makes a little bit more of a more relaxed working environment. And if your nursing staff is comfortable with each other and comfortable with physicians, they're also comfortable to advocate for that patient.
Absolutely.
And that is probably 50% of my job, is to be a patient advocate. And I think that's important for the community to understand that our nurses care very much about their patients, and they are willing to go to bat with the physicians, and make sure that they're receiving the care that is that is valuable. A nurse spends so much more time at a patient bedside. A doctor may have 10, 20, 30 patients or more. A nurse has a few patients. Therefore, that doc depends on our eyes, our ears.
Absolutely. You just took the words out of my mouth, because really the nurses are the eyes and the ears of the physician, giving the care. Early on, and I know we have a question, but early on in my medical training, I grabbed onto the concept that nurses can either make you or break you, and it's really true. And so I've chosen in my path and journey of being a physician to really kind of embrace the nurses and work very closely with them. The outcome is better patient care.
Absolutely, yes.
We have a question, Joe.
We have two callers here so far. I'm going to switch the order around because we're going to go to Johnson first in Gold Canyon. He wanted to say he's so appreciative and wants to thank you and your hospital in Florence. Saved his good friend's life, and very quick. And he was a nervous wreck when he went in. And not only did you take care of him, you took care of his friend. You took care of him as well. Mm-hmm. And he wants to say thank you so much. And their group in Gold Canyon are definitely going to be going to Florence Hospital when they need to go to a hospital.
Very
and thank you.
It's our pleasure. Thank you for calling.
Absolutely.
Mm-hmm.
And Darlene from Mesa says, sorry to call and interrupt the show, but she's a nurse, an RN, and wants to know if you guys are looking for RNs because she wants to apply.
Awesome.
Wants to be one of the happy family out there at the hospital.
It is a family.
It is.
That's really that's the perfect word.
Absolutely. That's what I hear anywhere I go. And as far as to answer Darlene's question about are we hiring, I would have to look at the website. I'm so busy every day with the day in and day outs of the emergency department. I'm probably going to have to tell you no at this time because we are fully staffed. But I love to take the applications. I read through them and just keep applying. That's the only thing I can tell you.
Mm-hmm. So our website is just what is gilberter.com.
Mm-hmm. And then fhanthem.com.
Mm-hmm. That's great. Any other questions, Joe?
I just want to thank you personally, Dr. Borik. Last week I went in with my wrist, and I have to say, it was like a family. I mean, I felt so comfortable in there, and everyone was so nice, and it was not, you did not have the feeling, I did not have the feeling of being in a hospital. It was amazing.
Right. And I think we got the information quickly for you.
It was amazing.
Yeah.
It was in and out, and I look at hospitals differently now after going in there.
That's neat.
So
that brings me to a question, Janet. In the ER at Gilbert and Florence, there are certain tests that we do that some other hospitals don't do. For example, MRIs. Do you want to kind of give us a little information about that?
MRI is, in a lot of ways, the gold standard in diagnosing for many conditions. I think it's important that our emergency physicians have that capability when they deem appropriate to order that MRI. Sometimes the CT may not quite show it or the ultrasound. And it's important that they have that flexibility.
Right.
I've worked in other places where they don't even have an MRI in the building, let alone at disposal for the emergency room physician to use.
And that's very true. Right here in our valley, there are places where the ER docs are not allowed to order an MRI. I mean, I don't want to say not allowed, but really it has to go through an approval process.
Right. That reminds me of something at both facilities that we stand very true. When it comes to patient care, the answer is always yes. What is your question?
Right.
We feel very important that we need to take care of our patients first. We'll figure the rest of it out later.
Not only for the nursing staff, but I can tell you also, as the chief of staff of the hospital in Florence, for the medical staff. How many times have we heard Dr. Johns, who is the founder of the concept of this hospital? The answer is yes. Now, what was the question?
All the time.
Yeah, and so we really we see that, and that's really great. The economy is just I would love to hear from you how you feel the economy is impacting nursing today.
The economy definitely is impacting nursing. I've got to be a nurse through the heyday where we could be as fickle as we wanted and jump facilities. Now it's nursing. It's not as easy to find a job, especially to the new grads. Nurses are working much longer, which is such a benefit to all of us. You can't teach experience. You can just share your experience. I know a lot of our patients come in, they don't have medical insurance, and that's why they are in the emergency room. They ask, is this an emergency? Can I be seen? I don't know if I can even come here. And the answer to that is always yes. What is an emergency? You don't need me to define an emergency. If you have that question, the answer is yes.
Right.
If it's perceived as an emergency to you, it is an emergency, and we will take care of it as an emergency.
Right. So there's really nothing too small.
No.
I mean, if somebody feels that they need to be seen, the hospitality of the ER is there.
Yes.
And that's what I hear you say. Is that?
That is so true. So many things have changed in nursing. One of the biggest recent challenges and I know this is partially due to the economy as well, is we've switched to an electronic medical record.
Okay, right.
This is partially mandated down through the government. I don't know all the ins and outs to that, but I do know as a nurse, one of the reasons I kind of gravitated to the emergency room, I never had to worry about, does the patient have insurance? Is the insurance going to pay? I just took care of patients.
Exactly.
And half the time, if we got it all documented, that was good. But we were just here to take care of the patients. And now, we have to not only take good care of our emergency patients, we have to document all of it appropriately. We need to be able to tell that story to the next care provider so that they can look in our chart and see that. And so the insurance companies can look in and see that and pick what's appropriate to reimburse, things like that. So
that the patient doesn't get caught in the middle in those kinds of things.
Yes. So as nurses, we have to be much more educated now than we ever were, with this economy the way it is, to make sure that we're covering all those bases in our nursing care.
We did just go, live with the electronic medical record. How is that going? I know how it's going on our side with the docs, but from a nursing perspective, how is that running?
Yeah, what a challenge. This is one more area where having multiple generations within one facility has really benefited. We have younger nurses that have literally grown up on the internet, and then we have others that have had to learn. You take a very experienced 30-plus nurse, she's been doing this for 30 years, and then you have a 20-something young nurse that he grew up on the internet. This is no big deal. He doesn't quite understand what's the challenges, but they're working very closely together to teach each other. The experienced nurse is sharing their experience, and that younger nurse is teaching all of his knowledge on how to operate that computer. It's been challenging, but I think in the long run, it is going to see to it that not only are we providing that really good care, we're also documenting it, and we're doing it more efficiently. We don't, at some point, we're not going to have someone sit down and review every chart to make sure that all the, the charges are captured and that the follow-up was appropriately done. With this electronic medical record, we get to communicate with each other almost instantly.
Right.
I know the physicians can look at images from wherever they are. They can put in their orders, which kind of eliminates that, the nurse on the other end of the order looking at it going, I can't read this.
Exactly.
It's all clearly typed in there. I think it's, in the long run, going to be a very positive thing.
What I was very impressed with as we were developing the team to launch the electronic medical record system in the hospital was the super users. The teachers, the people that actually were there rounding with me one-on-one, teaching me and helping me through my day and helping, fellow nurses, were the nursing staff that actually were, floor nurses. I was very impressed with that. There was a nurse from the ICU that came out, it was a super user, and then all of a sudden you're looking around and the charge nurse that used to be the charge nurse now is a super user and is working to help me manage my day. That really says a lot to the nurses.
This is something we really did right. I've worked in other facilities where a new change came on the horizon. We all went to a class. 2 hours, you're now an expert, go back to work. And then we muddled through. And then with this new process, we actually, we weren't looking at, staffing numbers and staffing matrix. We actually pulled these people off the floor.
That's what I mean. Yeah.
Pulled them out of the patient care arena so that they could help guide and mentor those nurses and techs and physicians that are still caring for patients and guide them through the process of this electronic medical record instead of trying to juggle, I have 4 patients and now I have to figure out this computer system, and none of that was a factor. In fact, we still have people that are answering questions that are available either by phone or right across the nurses' station that are experts in the subject matter. It was very impressive that Gilbert and Florence hospitals allowed us this time to make sure we did it right.
You know, I think that speaks to the general public to really let them know that the hospital really takes steps because patient care does come first.
Absolutely.
And I mean, it's a perfect example. It really, really is. Wow. Joe, do you have a question?
Got a great comment from Tom, who's a physician's assistant in Phoenix. Says our office has been watching DocTalk for 5 weeks now, as well as our patients in the waiting room.
Wow.
So they have that in the waiting room live each
That's
week.
Great.
And he just wants to say that just by watching the radio show, you can tell that your hospitals really, really care about the people. It's a great public service, and maybe one day I can be part of your hospital family. They love the show.
I'd love to have you on, Tom. That's great. Maybe we can, you can connect with us and get us your email. That would be really, really great. Let's go to talking a little bit more about what our hospital has to offer from a nursing perspective. Somebody just a little bit ago wanted to, put in their resume. Why?
From a nursing perspective, I can give you my example. Mm-hmm. I came in shortly after they opened as a staff nurse, and they taught me the new way, the door-to-doc in 31 minutes. They assured me that it would be okay to do things this quickly. That was a kind of a trying time in my nursing career, because all of a sudden I went from being that primary care nurse that took care of every aspect of my patient. Now I have to share my care with a paramedic and a tech. Mm-hmm. That was a little challenging at first, because nursing is about trust. You have to learn to trust the tech that is going to assist you in that care, or that paramedic, that they're going to be doing things correctly. The leadership that was in place at that time, they guided me through that process, teaching me to be a more effective team leader. They quickly pulled me into a charge position, and they guided me and mentored me that in their way of being that resource manager on the floor. And I learned very quickly that the physicians, the nursing leadership, were very receptive to that bedside nurse. That as a charge nurse, if I went to them with a specific problem or a specific patient care issue that we need to take care of in a better manner, they listened.
Right.
It doesn't take 5 committee meetings and this and that to change our way. If we present something that's evidence-based, that's going to take good care of our patients, we listen. We have changed policy because of the newer practice of the way it should be. We feel very strongly that if you take your nurses that are associate trained and move them up into a bachelor trained nurse in the higher education, that the outcome of your patient care is better.
Right.
I have benefited through Gilbert Hospital for that. I came in to work there as an associate trained nurse. I now have my bachelor's degree, and I'm very close to getting my master's, and I could not have done that without Gilbert Hospital not only helping me through that financially with tuition reimbursement. They're always there to answer questions, to help me with projects. There's just a vast array of talent within that hospital.
So the hospital does reimburse for people going through to higher in their education?
Oh, yes. We demonstrate on a daily basis that higher education within nursing it provides better patient outcome. At any given time, we have at least 10 staff members that are pursuing that higher education.
Mm-hmm. I mean, there's a nurse educator that's on the floor that is there.
We provide classes to our staff, not only the AHA, the American Heart Association, being the CPR, Advanced Cardiac Life Support, PALS, which is the pediatric version of that.
And it's open to the public as well, is that right?
Yes. We provide it to our staff, but we also, if there are other nurses out there that work for a smaller facility that doesn't offer these classes, they're welcome to come into our classes. All that information should be on our websites as well. Mm-hmm. Our nurse educator also is quite frequently providing classes, for example, like electrolytes, burn care, a variety of different classes that help make our nurses better nurses.
Mm-hmm. And a lot of times that, our nurses, the educators, work very closely with the EMS. Isn't that right?
Yes, we have an EMS paramedic coordinator, mm-hmm. and she's very on top of what's going on in that pre-hospital environment. She has a lot of years of experience in this field, and I think she knows just about everybody.
It's amazing. I mean, that's exactly right. It's the EMS nurse coordinator.
Yes.
Right.
We also have EMTs and paramedics that are employed within the emergency department to help coordinate that care. They bring us that experience and that knowledge of what's happening pre-hospital and carry it on into our hospital care. I can think of quite a few interviews that I was privileged enough to sit in on of paramedics, and I asked them, why do you want to work in the hospital? And abundantly their answer was, we take care of our patients in the field, we stabilize them, we bring them to you, and then we leave. We have no idea of what happens beyond that emergency stretcher. And this gives them that opportunity to see what happens to their patient once they drop them at our facility, so that it gives them a little insight when they're out there in the field of what's going to happen. And I truly believe that gives our community better care.
Absolutely. And I think, lower turnover, lower burnout rate, it keeps it exciting, and I think that's important.
It is important.
Mm-hmm. Joe, you have a question?
We're getting a lot of employment calls now. Can we just give people a place to call?
Yeah, I think the website would be the best place.
Great, terrific.
Which is www.gilberter.com. Is that right?
That's correct, or FHA or FHanthem.com.
Okay.
And don't get me wrong, we'd love to say hello and talk to you and chat with you, but there's nothing I can do about the employment thing.
Right.
So that resource there is what to do. And thank you so much for listening. We really appreciate your listening to the show.
Janet, what would be in your opinion, the biggest challenge of working as a nurse in general today, and as a nurse at Gilbert Hospital?
I think some of the biggest challenges that I've experienced in nursing has to do with keeping up with what's current. Mm-hmm. And I think that's where we use our younger nurses that are straight out of school, our paramedics, our nurse educator, the paramedic coordinator, knowing your resources. You have patients that come in every day that come from different cultural backgrounds, different educational levels, and you want to make sure that you're providing them the care that they understand. Right. That's very important. I think that's something that nurses do very well. Sometimes we have to take a few extra moments within our discharge process to make sure they have those resources beyond that few hours that we get to touch their lives. And I think that's one of the biggest challenges that, as a nurse, that I've experienced, is making sure that, not only am I giving them the discharge instructions that they need and the care that they need in the emergency room, but make sure when they leave us, that I feel comfortable that they're going to get the information in that short little encounter in their lives that I have with them. I know the other day on the floor, one of the paramedics was talking to the PA, the physician's assistant, that had never had children, was very educated in how to care for children on a medical standpoint, but the paramedic, father of 5, says, would you like me to do a PO challenge? Give that child a popsicle. Sometimes they respond very well. It'll soothe their gums, or,
right.
I overheard this conversation and I thought, this is what we do. Mm-hmm. That PA was actively listening to this father of 5,
right,
and incorporating that with that PA's education and skill level, and coming up with a good plan of care for this baby. And I know in the emergency department, sometimes what's an emergency is these new parents that really have no idea. Right. They were given this baby with no instruction manual, and that's part of what we do.
Right.
We take care of each incident as it comes up and make sure that we're teaching our patients.
That's huge, because often, the nurse, when you give the discharge instructions, that's really the last encounter before that before that patient leaves. So that's what they're going to remember. The other thing that we're challenged with today is readmission rates.
Yes.
And how to keep that down, and how to kind of streamline and keep things efficient. And I think we're well aware of that. And I think part of what you're saying is due to that.
Yes, a lot of powers above us, above the hospitals, that the government, different agencies, they're looking at patients that are coming back into the hospitals, why they're coming back in. Right. Was it on the nursing staff? Was it on the physician orders? Did we not do something that's going to keep them out of the hospital? And so we've took a deep look at that at Gilbert and Florence Hospital. We're looking at our readmission rates. We're looking at those charts. We're going back through them. Is this something that we could have done better? And I think that's something that as a facility as a whole, that if you're looking at what we could have done better, we're going to get better.
Absolutely. Absolutely. Patient satisfaction is also one of the things that we're looking at.
Absolutely. That at Gilbert, it kind of goes over not just patient satisfaction, but customer satisfaction, how we treat each other and our patients. So that's important.
Very good. Joe, question.
Sally Muse of Mesa would like to know, does your hospital have any off-site public health clinics or screenings?
We do community-type projects, in terms of flu clinics and so forth. Do you want to speak to that, some of the things that we're doing, TOPS and all that
Yeah, we
kind of
do.
stuff?
TOPS is something that comes to mind fairly quickly. This is a fabulous program that we offer free to the public. It's for high school athletes to get their physicals. During this physical, they also get an EKG and, if needed, an echocardiogram. And this is unheard of to receive this without being paid.
Right.
And I think you could probably address a little bit more of that.
We do.
Dr.
We
Borik.
see probably over 1,000 kids in a day. And they just come through. It's staffed with the ER docs. Cardiologists are on site there. And every single student athlete gets an EKG. And then, it's looked at. If it's interpreted in a way that maybe there may be an abnormality, right there at the site we have the echocardiogram to be done, and the cardiologist is there to read it. And I think, in the last few years we've picked up quite a few abnormalities, structural abnormalities within the heart due to this screening, which, possibly could be, they can save this saves lives. There's no doubt about it. When you hear about sudden death of athletes on the field and so forth, this is the type of screening that we want to do, and it's free to the public. So that's one of the things that Gilbert Hospital is doing. Do you have another question?
John Gerard from Gold Canyon would like to know, he's seen so many things on TV and radio and different places at his doctor's offices. He doesn't know, and he's got some friends as well that would like to know what he should do about. He's a 69-year-old type 2 diabetic. As far as getting the shots, the flu, the pneumonia, and now he's very concerned because he just heard a big thing on the whooping cough.
Okay.
Do you recommend those?
Absolutely. And one of the things that we do is we do have these free flu shot clinics that we offer at the hospital. So again, you can check the website and get the dates and the locations and so forth. But the flu shot, let's talk about the flu shot first. It is recommended. And I know that from a nursing staff, now it's pretty much required for all staff to get the flu shot. Isn't that right? Or is
pretty much. There are those exceptions of staff that are allergic to it, but for the most part, it's one thing I can do to protect my patient.
Right.
I come in contact every single day I would say with potential flu patients, and I don't want to carry that off to my next patient. I don't want to carry that home to my family, so this is something I can directly do to protect them. I know we do offer flu clinics where we're giving those injections free of charge, and what's really wonderful about our hospital is we have so many nursing staff that volunteer to do this on their days off. They go out and give these injections to the community because we know that it's the right thing to do.
Absolutely. And it is recommended, just for the gentleman that just called from Gold Canyon, I believe. It's recommended for any healthcare worker, because we're exposed to different infections and flus and viruses, that we get the flu shot so that we're protecting our patients, just like Janet said. It's also recommended for anybody that is over the age of 60, actually 55, 60, anybody that has chronic medical conditions, for example, diabetes, kidney problems and so forth. I think that's really important. So yes, you probably would fit into that category of requiring the flu shot. The question that I get is, when I get the flu shot, does it make me sick? Do you get that question?
Quite frequently. I can't speak for every patient because, we all react a little bit differently. I know my personal experience, I've had a flu shot every year since I was 17 years old, and I really couldn't say that I've ever had the flu.
Right.
And I've been exposed to it over and over and over and over. So.
And I think, there's hundreds of viruses, and I think what the flu shot does is it protects us against the most dangerous influenza of the season, which really helps to, it doesn't mean you're not going to get the flu or sick or a virus, but it'll protect you against the most dangerous types of flus that can lead to death, and that's really what we're trying to do. The pneumonia vaccine is the other thing. And the Pneumovax is recommended once every 5 years in people that meet criteria. For example, for the older population, the Pneumovax is recommended. For those that have chronic medical conditions, anybody that has a history of cancer, immunosuppressive type processes, those kinds of things. So absolutely. And in fact, in the medical record that we were just talking about, patients that come into the hospital, there's a prompt where every single patient, is it a requirement that we have to ask them if they gotten the flu shot or the Pneumovax? Do you want to talk about
I know
that?
in the emergency department, because that's where I work, we ask all of our patients, especially during the flu season, if they're up to date with their flu shot, their tetanus vaccine, and then if they're of that age group or with the comorbidities, we will ask them if they have had their pneumonia vaccine, and it prompts it right out of the computer program, the medical record. And I know when they get admitted, there is a questionnaire that the nurses fill out, and if they meet the criteria before discharge, they will receive those vaccines as well.
Right, and I think that's across the board at most hospitals. So, did you have a question, Joe?
Frederick Lewis from Florence, and I did mention to Frederick that this show is not meant to be a substitute for medical attention or seeing his doctor. He said that he's been getting bloody noses lately. He's on an aspirin regimen daily, and he's noticed that his skin seems to bruise easily and even tear. He's fairly healthy. He's a 64-year-old male and wants to know, should he seek medical attention, or is there some kind of test he should get done?
Probably. I think, whenever I hear, just in general, frequent nosebleeds, frequent bruising, something that we call petechiae, which are red spots on the skin, that in my mind tells me that there may be something going on with the clotting ability in your body. So I would absolutely recommend that you seek out some medical help, get a blood count, see what your platelet count is, see if you're anemic, see why is this happening. It may be absolutely nothing. It may be just from the aspirin, but it is something that needs to be looked at.
Is this something you should go to the hospital for, Florence Hospital at Anthem?
That's a good question. For nosebleeds that you can't stop, we see that all the time, right? That's an emergency.
It is. And it's one of those things that's very scary for a patient, and I assure you, we take care of them all of the time. And sometimes it warrants more than just stopping that bloody nose. Sometimes they need more of a medical workup. And the emergency department, that is what we do. Right.
Now, having said that, if the nosebleeds are very scant and it's not an ongoing nosebleed, but yet you feel that there's bruising going on and the skin is thin, that really should be a medical workup that should be done through the primary care doctor's office. And so that's really kind of where I would direct this gentleman, Frederick, to go to. Certainly we're there if need be, but this is probably something that should be done on an outpatient basis and worked out, because there's a lot of different things that need to be looked at. The challenges. We were talking a little bit about the biggest challenges of working as a nurse at Gilbert. People we're inundating our calls and they want to, work at the hospital. But I want you to kind of, on the flip side of that, what are some of the challenges that you see in working there?
Been very privileged, to work with this staff that has had very low turnover. And I think in that same sense, that is a little bit of a challenge when we do have a new employee come in that's worked at other facilities. It's very common for someone to say, well, when I worked at X hospital, this was the process. And I do believe our staff handles that very, very well. That is a challenge, especially if you have someone come in to feel like the new kid when 90% of the staff knows each other. We know, who has kids and grandkids, and then to welcome this staff member in, so they participate in our environment. There are things that we don't hear at Gilbert. One of those is, it's not my job. Another thing, like we had addressed earlier, that the answer is yes. Before you even ask the question, and that's kind of a challenge to welcome new staff in.
Right. When we get a little slower in the summer months, it's not uncommon to see or to have nurses there that actually work at other hospitals in the area. And I always try to kind of, get a little personal and say, how does this hospital compare to, down the street? I don't know if you see that or, in the ER as much as on the inpatient side. But, we tend to really kind of get a feel that they're very happy to be at our hospital.
Absolutely.
Yeah.
We are nurses. I think we do what we do because we like to take care of patients. We like to take care of people. And in the summer, when we don't have that many, they do seek out other opportunities to care for patients. And I actually welcome that because it gives you perspective. When you go somewhere else and you see the care that patients receive, not that the care's not bad, it's just different.
It's different, right.
And they come back to us and say, oh, this is the way it's supposed to be.
Right, and we see that, and we hear that all the time. Do you have a question, Joe?
Yes, Raina from Gilbert would like to know, do you or your hospital have a list, maybe online, of primary care physician referrals that you or your hospital is confident will provide excellent care? Insurance is not an issue with her, so just wanted to know.
Raina, thank you for asking that question because, we're really focused talking about the hospital, but there's a whole other place, which is the outpatient clinical setting, which is very, very important. And so I want to kind of give you, as a hospitalist, meaning that my practice is an internal medicine physician practicing in the hospital. The biggest challenge that I have, especially in the wintertime when we see patients that don't have a family primary doctor, is when I discharge that patient, where are they going to follow up? Who are they going to follow up with? Because honestly, if they don't have somebody to follow up with, I'm going to be a little bit more protective of them and maybe, not want to discharge them, too early, make sure that they get adequate care in their primary care doctor's office. So the one thing that we've done actually at Gilbert, and we're going to be planning very soon at the Florence Hospital at Anthem, is what's called a continued care clinic, which is where we have an office that is adjacent to the hospital. When you're discharged from the hospital, you have the opportunity to follow up with, like myself, as the hospitalist that took care of you, for up to 3 times after the hospital stay in the office. And then in that time period, we, myself, along with Ruth and the staff, would generate a primary care referral list for you that then would plug you into a primary care physician that you can see down the road. But the problem is that everybody's so busy these days, and especially in the wintertime, if I were to discharge you from the hospital to Dr. X, you may not be able to get in for a couple months. But if you come to the continued care clinic, we can kind of transition that care. It's kind of bridging the care from hospital to primary care physician, like hospitalization to primary care physician. So it's that bridge, and so we do that at Gilbert Hospital. We just started that, and I think it's a great example of what we're doing at the hospital. Because honestly, I don't know of any other hospital, and I'm really connected to a lot of the other hospitals and hospitalists in the area that they don't really have that. So
I know through the emergency department, I can speak for our physicians that work in the emergency department. We go to great lengths to assure that they're providing a referral name for whatever reason you came into the emergency department. We want to make sure if you don't have a primary care physician, or if you've never been to an orthopedic doc or a neuro physician, whatever it may be, that they provide you with a name. And I know a lot of times as a nurse on the floor, as a charge nurse, we receive phone calls that come in. I was at the emergency room, you referred me Dr. X, I can't get in there, what do I do? And all those calls are answered usually by a charge nurse. And we have a doc sitting right there beside us. We have a list of physicians. And many times it's required 2 or 3 phone calls, but we have, successfully got these patients to where they need to be.
Right. And oftentimes we'll make the appointment, for the patient. And not only a PCP, but a specialty list as well. So, for example, if you come in and let's say, you're being discharged and you need a cardiologist, well, we have a list of cardiologists that we can refer you to. So, yes, we do have that. Raina, thank you for calling. That's a great question. But the continued care clinic, I think, is in alignment with, achieving the goals which are really being put on us, which is decreasing length of stay, getting our patients out in an efficient manner, decreasing and reducing readmission rates, because if you go in to see your doc to get that pro-time done, to get oxygen, whatever the case may be, it's going to kind of keep that patient safe at home and not readmitted into the hospital. And that's the goals that we're trying to fulfill. So that's great. Let's do anything else you want to kind of throw out. You talked about turnover rate with the nursing staff, and we do have a very low turnover rate with the nursing staff there. And I just want to kind of let folks know that from a medical staff perspective, we are an acute care facility. So OB, let's talk about that for a moment, because, again, we're not just an urgent care. We have infection disease, we have cardiologists, kidney specialists, general surgeons, orthopedic surgeons, podiatrists, hematologists. We have the whole array of specialty services. But OB is something that the ER...
Right. We do. Our emergency room physicians are board-certified emergency room physicians, which means they can handle any emergency. They can evaluate and treat. Our nurses, we do annual competencies to make sure that they are able to proficiently care for patients from all aspects, from birth to death. But to include in that is pediatrics and OB patients. We don't have the capability to admit these patients.
These patients meaning what? Pediatrics
the
and
pediatrics
OB.
And the obstetrics. When they come in, the physicians, we evaluate, we treat, and if they need admitted, we do have to transfer them to a facility that has the capability to care for an inpatient obstetric patient or an inpatient pediatric patient.
Okay. But we do GYN
Yes.
type procedures and care.
Yes, we have a GYN physician, a gynecological physician, that can do actually even surgical procedures within our hospitals.
Very good. Very good. Joe, question?
Marsha from Mesa would like to know, does the Gilbert Hospital do maternity?
That's exactly what we were just talking about.
Sorry, I didn't know the lingo there.
That's great. No, that's good.
No, that is good. Sometimes we use these words and we forget
Right.
that what may be common knowledge for a nurse or physician is not. If you have a pregnant mama and you have an emergency, if we're the closest facility, by all means, we do have the capability to evaluate and treat. But as far as your obstetric or your maternity care, please follow your physician that is caring for that pregnant mama. Follow their guidelines and their advice.
We don't deliver babies.
Oh, we have, but we don't.
Exactly.
We don't have the follow-up care right there in the facility.
And you said really something very important, I think, for our listeners to hear, that all of the emergency room physicians, physicians are board certified, so they can take care of any emergency.
Yes.
So an OB or a maternity, is an emergency that can be taken care of there. However, if it's the closest place, obviously that's where you want to come. But we don't take care of the aftercare, and that's
Right,
important.
And that's important. So have those conversations with your baby doc, with your physician that's providing your pregnancy care, of where they want you to go,
Right.
and make sure that you're following their advice.
So if you have an emergency and you're rushing by in a taxi, don't keep going. Make sure you pull in.
You can, but you continuity is important too. So keep that in mind as well. That if your doctor, your obstetrician, your gynecologist, works out of X hospital, then that would probably be the best place to go to get the best care.
Absolutely.
So that's really important to
Now, as far as
to know.
the pediatrics, we're right there in Gilbert and in Florence with lots of families all around us. We care for kids very well every day. Very few children actually need admitted. A lot of times they just need that evaluation and treatment.
Right.
Just remember we're there, and
Yeah, that's probably one of the strongest points of the ER, of our staff, is they're very competent in taking care of pediatrics.
Absolutely.
Yeah, and I think that's good. Do you believe we're almost out of time here? Wow, this really flew, didn't it?
Yeah, just one more thing about taking care of those obstetric patients. All of our nurses within Gilbert Hospital have a certification called NRP, and that is the emergency care of that newborn infant. So this is something that we've done to better educate our staff, so that when that emergency does come in, that we're better prepared, and we do redo that certification every 2 years.
That's interesting. Talking about certifications, when the discussion is about organ donations and so forth, is there a certification that has to be, do nurses or anybody have to be certified in order to talk about that to a patient or a patient's family?
Yes. There is a class that is provided from Arizona Donor Network to make you more competent in having that conversation. One of the first things they stress is if you're not comfortable, by all means let that conversation wait. But they do provide us classes, and a lot of our nurses have been certified through the Arizona Donor Network year after year.
Very good. Very good. That's great. Let's kind of close the last few minutes and go back to the myths about Gilbert Hospital, because I really want people out there to hear, and again, set it straight as to what we do there. I know you said a few things, but let's kind of reiterate that in terms of, we're 24 hours, 7 days a week. Do you want to kind of give us that again?
Emergency services. We have inpatient, so if your emergency becomes actually admittable, we have an inpatient services. We have ICU. We have a wide variety of surgical services. We have a full lab, the MRI, CT, X-ray, nuclear medicine, ultrasound. We have a very skilled staff, nursing and physicians to care for anything that comes in.
Okay. And we're not a veterinary hospital, and we're not an urgent care. And I think that's really what we want to echo.
And there's one more thing. We are a safe haven for newborns. Should a distressed mother become in need, we will accept the newborn infants without questions asked. We have an outpatient diagnostic imaging. So if you have an order from a physician for an X-ray, a CT, an MRI, we can do that without appointments, 24/7. I know some of those procedures actually need an appointment, so you might want to give a phone call to the hospital, to the outpatient services, to make sure they don't need to set up an appointment for that.
Right.
But we do that 24 hours a day. So if it's not within your schedule to get an X-ray done at 2 in the afternoon, you could come at 2 in the morning with that order.
That's a great point. What you just said was, instead of waiting, 3 in the afternoon, 4 in the afternoon, you can come later that evening,
Absolutely.
after dinner, whatever the case may be, and we can provide that service, which is really neat.
That's amazing.
It really is. It really is.
We have the staff there. We might as well do it.
It's true. It's really true. One of the other things that we're doing that I just want to kind of put a plug in is the wellness program that we have at the hospital. And it's really directed for the staff. So, at Gilbert Hospital, Florence Hospital, at Anthem, we have a pretty great wellness program designed where we have a clinic right there. So if the staff gets sick, like this morning I just saw 3 patients, right off the bat, instead of the staff having to take off, go make an appointment with their doctor to be treated for a sinus infection or upper respiratory, we can take care of them right there, and it works out really well. In addition to that, we have programming. We have like yoga classes and exercise classes and relaxation classes and so forth that kind of we encourage the staff to be part of, that I think also lends to them being happier and healthier, and I think that's important.
Absolutely. As a staff member, I know that I have a primary care physician, but I know you. And it's much more comfortable if I'm ill just to go in, run in there, get a quick appointment. I don't have to wait a week or two with someone that we have an established rapport with. It's great.
It is. And, and if somebody sprains their ankle, we can get the X-ray, we get the results back. It really works. And so, I just wanted to kind of put that out there. Janet, thank you so much for taking the time to come over. This has been a great conversation. And I think those people listening, again, if you're really seriously interested, check out the website. You can go to Gilbert ER. It's Gilbert?
GilbertER.com.
GilbertER.com. Or you can Facebook us. DocTalk Radio. You can always connect with us somehow. DocTalkRadio.com is one website. Or you can go on Facebook and friend us, and you can always get a hold of us. And I would hate to miss the opportunity to bring somebody into our family if they really have, what we need and what we could use. So that's great.
Just remember, if it's an emergency to you, it is to us as well, and we'll take good care of you.
Right. There's nothing too small, so that's good. All right, I think that's it, Joe. Thank you.
All right. Thank you for listening to DocTalk Radio.
This concludes DocTalk Radio with Dr. Ann Borik. Till next time, I wish you health, wellness, and many blessings.
DocTalk Radio is brought to you by Gilbert Hospital and Florence and Anthem Hospitals. Topics discussed are for informational and not intended to substitute advice from your personal physician.